Hello, good afternoon, TYP family, and welcome to our Real Talk Show, a show where we talk about nothing but real life situations, a show where we stay informed and we give you conversations that just keeps the matter going and our community to be able to communicate with us at the end of today. At the end of the day, today we have a very amazing and yet interesting topic that really sparks a lot of debate and confusions around us as young people or even the community. Well, we are looking at access to consent. So, what is it that we are looking at? We have, I hope you have seen the amazing faces on the screen right now. These are the people who are going to help us to just talk about this access to consent. What challenges do we get to face as young people, and what help do we need? These people are going to help us just elaborate more and just keep the conversation going. So, on the screen today, I have Andrew Simata. Andrew Simata is the Youth Sustainable Advocacy Projects Officer, is managing a project here at TYP. We also have Kuzai Meda. Obviously, some of these positions that will just give them an opportunity so that they can just introduce themselves before I mess up things. It's not nice to mess up things on the screen like this. We also have Nokupewa Moyo, who is also going to just give us an introduction of who they really are and what they're doing. I welcome you all to this show. I'm going to start with the introductions. I'm going to allow each one of us, in case I didn't do justice in introducing you, I'm just going to allow each one of you to just give us an introduction of your name exactly and what exactly you are doing at the places where you're stationed. So I'm going to start with Kuzai, and then we'll go to Nokupewa. Andrew will be the last person. We can go ahead.
Thank you so much, Margaret, and good afternoon, viewers. I actually thought you were going to start with Andrew, but anyway. My name is Kuzai Meda, and I'm the Policy Advocacy and Campaigns Lead under the Regional SRHR Fund at HIVOS. And I'm also based in Zambia. Thank you so much.
Thank you so much, Margaret, and good afternoon, viewers. My name is Nokupewa Moyo from Youth Advocates based in Zimbabwe. I'm the head of impact and programs. So at Youth Advocates, basically, we are just a youth-led organization which works to amplify adolescents and young people's voices with regards to their sexual and reproductive health rights. So looking forward to engage with you and discuss more. Thank you, Margaret.
Good afternoon, my fellow young people watching us from across the globe. My name is Andrew Simata. I'm the project lead for a project we're calling the Youth Sustained Advocacy Project here at the Youth Platform 360, based at the office headquarters in Choma, Southern Province.
Great. Thank you so much for those beautiful introduction. So in case you are wondering, like to the person who's watching this right now, you're like, consent to access, what is it that they're talking about? Well, consent to access, this is a campaign which is supported by HIVOS through the Regional Sexual and Reproductive Health and Rights Fund. So the campaign advocates for better laws and policies on age of consent for adolescents to access sexual and reproductive health services such as HIV testing, access to contraceptives, and of course, health information. So no wonder we've brought these people. I mean, Kuzai just mentioned that she's from HIVOS. So she's going to give us a perspective from HIVOS, and she's just going to help us understand what exactly consent to access really is and what is it that we're focusing on. So this conversation is hot, I should say. It's fire, because we are going to learn, we're going to obviously discuss certain things that get to affect us as young people at the end of the day and just try and find the solution to this. But before we even dig deep into the conversation of today, I'm just going to allow Andrew to just give us an introduction of what the project he just mentioned, the Youth Sustainable Advocacy Project. What is it all about, so that we can just keep the ball rolling? Andrew, you can go ahead.
Thank you so much, Mag. So the Youth Sustained Advocacy Project is one of the key projects we've been implementing with support from HIVOS through the regional SRR-HR fund. So the project kicked off sometime September last year, and its overall goal is basically to provide adolescents and young people with the much needed knowledge, skills, as well as tools to meaningfully engage in, conversations and discussions that are aimed at influencing policies. What sort of policies? The sort of policies that drive sustainable health system improvements, ensuring there's equitable access to quality SRH services amongst adolescents and young people. So working through the Ministry of Health at district level, that's the district health services, and with support from the local health facilities, staff and peer educators, we seek to achieve two things with the project. First and foremost, to ensure that the health systems are more efficient and effective in order to deliver those SRH services out of superior quality. And to do this, I think feedback from the adolescents and young people themselves is very key. And so that feedback is one that we hope to get through or garner by way of online conversations like these. We also get to the ground and hold interactive sessions. We also do, at personal level, interact with the young people to get their personal experiences as they access these SRH services through what we're calling a community-led monitoring process, which we report on a monthly as well as quarterly basis. So while doing this, in the second objective, we hope that wherever young people will find themselves, they are enlightened enough to be able to speak convincingly with data and knowledge and the skills and the tools that we're talking about. Having access these things that we're talking about, they'll be able to meaningfully engage. I hope that's helpful for now. Thank you.
Thank you so much, Andrew, for that background of the projects that you're currently leading on. So as I mentioned earlier to say, we are looking at consent to access. So this is a campaign that is helping us as young people when it comes to having information on how exactly we can just access these sexual reproductive health services that are available for us in these healthy facilities. So I'm going to start with Maida. So she's going to help us just understand what the Consent to Access campaign is all about. Maida, you can go ahead.
Thank you so much, Margaret. So I'm going to just pick up from what Andrew said, right? So as HIVOS, what we did is we all know that, even viewers online, we all are aware that many young people face various challenges when it comes to accessing adolescents' sexual reproductive health and rights in East and Southern Africa. So amongst the many challenges that we are aware of, we noted that age of consent was one of the major barriers that adolescents and young people face in the region. So we then basically, through a co-creation process, we then were able to co-create and identify age of consent as being one of the major barriers, and we then coined a campaign around it. So the campaign is dubbed Consent to Access. Like I mentioned, this was more of a participatory advocacy agenda setting process, which was mainly spearled by the youth-led and youth-focused organizations that we work with. I think some of them are actually on the call. The youth platform, we also have youth advocates on the call. The main aim of the campaign generally was to ensure that we promote adolescent sexual reproductive health and rights in East and Southern Africa. So when you look at what we're trying to achieve, we're also trying to ensure that there's enhanced advocacy for improved laws, policies, and practices on age of consent for adolescents' access to SRHR information and services in East and Southern Africa. So basically, that's a bit of a background that I can provide for now as well. And I know that the colleagues on this call will also amplify. Thank you.
Great. Thank you so much for that, Maida. So I'm going to move to Nokupewa. So Nokupewa, Maida has mentioned the reason, like the background behind the campaign and what really led to them just coming up with this campaign to implement in different countries. Of course, Zimbabwe is one of the countries that is implementing such a campaign. And obviously there are a number of things that you're going to share with us. But for now, I just want you to like help us understand like the importance of having such conversations with young people.
Okay, thank you so much, Margaret, and thank you for the background from Kudzai and Andrew as well. So when we are looking at issues around access to SRHR services, this directly speaks to young people per se within the region, the Eastern Southern African region. So why is this conversation so important to young people? Despite different strides that have been made by countries, including Zimbabwe, Zambia, Malawi, Kenya, and Uganda, we still see that adolescents and young people are still disproportionately, face challenges in terms of reducing the HIV incidence, having high numbers of teenage pregnancies, high numbers of STIs, and all of this is coined to age of access when it comes to SRHR services. So when we are looking at the conversation and why is it important to adolescents and young people, it's important to us because we are the ones who are still affected by new HIV incidences, issues around teenage pregnancies, unwanted pregnancies, high HIV and STIs, STI cases amongst adolescents and young people. So this conversation is very important because not only looking around policies, not only looking around frameworks that govern the services amongst health facilities and to young people per se, as young people being involved in such discussions and in such a campaign, it gives us room to explain and to actually unpack how these issues around age of access, age of consent affect us as young people, not only in terms of accessing the services, but also facing the ripple effects in terms of if I don't access a service, what does it mean if I'm already pregnant? Does that mean that I'm supposed to be jailed to get an unwanted pregnant because of the fact that I'm of my age, just because of the age, and also looking at us as young people, it also gives us the leeway to engage and interact with policymakers and also share our views and concerns in terms of how are we supposed to access the services that we need at any given point. So also this conversation, it also brings in a lot of things not only related to issues around service provision and policies, but it also allows young people to say, for instance, if I need a service at a certain health facility, what does that mean for me as a young person? Is access readily available for me as a young person to go and access the service? One. Two, not only age, but we are also looking at other systematic barriers that affect young people. If I go there, am I handled like any other patient to access the services, or different other challenges that young people face? So with regards to what Kudzai said earlier on and to what Andrew said, the campaign for us as youth advocates and also as young people, it also gives us chances to also say we are involved in collecting the data that affects us. We are involved in the advocacy journey in terms of unpacking and articulating what we need as adolescents and young people. And also lastly, the campaign is also allowed us as young people, I'm also going to reference to say us as young people, not only as Youth Advocates, but us as young people to say from a regional scale, we are allowed to interact and also talk to different policymakers in terms of how we want services to be availed to us as young people.
Great. Thank you so much for that, Nokupewa. So most of the things that you have mentioned, these are things that are involving young people. And at the end of the day, when we talk of age of access, like young people being able to access these services, we have a number of barriers, of which one of them that you've mentioned is age. So when we look at age, we're going to find that a number of young people who are sexually active, they're unable to access these services due to the fact that because they are young, or maybe sometimes it's because of where they're coming from, the parents cannot allow them to just access those services because due to some of the reasons that they have. But at the end of the day, we need to understand that in as much as young people can be sexually active at a young age, there is also need for them to access these services, and these services are readily available for them. But what is it that we have to do in order to ensure that these young people are able to access these services? And the other thing I feel like is a barrier is when it comes to information. I feel like a number of young people do not really know to say these services are available, and they can actually just access them not at a fee, but free of charge. So in as much as we are trying to focus on this campaign and just ensuring that young people are there, we also need to put into consideration that these young people still need information when it comes to such issues. Thank you so much for that explanation, Nokupewa. So I'm going to go back to Maida. So you mentioned to say the campaign is currently running in the east and southern parts of Africa. So when you look at the countries rather, where this campaign has been running for some time now, what exactly was the reason as to why you had to choose the east and the south part of Africa in terms of just having this campaign there? What really led to that?
Okay, thanks, Margaret. So I think basically what Noku really spoke to as one of the major challenges or the many challenges that adolescents and young people face is these are some of the key reasons why we identified the East and Southern Africa region as our target region for us to be able to amplify our project. So when we then look at the countries that we then zeroed in, we're now mainly focusing in 5 focus countries. This is Zimbabwe, Zambia, Malawi. And then in the Eastern region, we're also working in Kenya and Uganda. I think in these 5 focus countries, the commonalities in these focus countries is the aspect of when you're looking at the issues around access, is the consent requirements that are one of the major barriers for adolescents' access to sexual reproductive health. And we also noted that in these 5 focus countries where their policies and laws, they actually lack clear policies and straight policies that speak to governing around the issues around the age of consent for adolescents as sexual reproductive health and rights services. And where the policies exist, there's actually lack of harmonization across services. So you hear the word harmonization quite a lot when you're talking about the issues of age of consent. So these are some of the prominent issues that have really come out, especially in the 5 focus countries that we're working in. And then lastly, you notice that there's a big interplay between consent for sexual activities and consent for marriage, as well as the impact it has on access to SRHR services. So in the region, when you look at the issues of access to sexual reproductive health and rights, you can't then delink them from the issues of child marriages and the other issues that adolescents and young people face. So that's why we then went ahead and identified the region, and then particularly zeroed in the 5 focus countries that we are currently working in. Thank you.
Thank you so much, Maida. So something that really caught my attention is I was reading on some document where it was just highlighting like the policies that we have. Like, for example, you've mentioned when it comes to marriage, sexual consent, and just the access to these services. And you'd find that in as much as we are having this campaign run in different parts of Africa, we're going to find that in each country we have different policies that we are focusing on when it comes to such. So maybe before I even say this, I would go to Noku and just ask her this question. So I know that Zimbabwe is one of the countries that is implementing the consent to access campaign, and through the youth advocates organization. So you've been one of the leading organizations in this campaign. How have you been doing it that you would like other people to just adopt? Like, you've been doing this campaign for some time, and obviously you have seen a number of things that other organizations like TYP can adopt in terms of implementing the campaign. So Noku, please help us with that.
Okay, thank you so much, Margaret. So maybe to answer the question, I'll start by alluding to the goal of the campaign. So as Kudzai highlighted earlier on, we adopted the campaign from the Consent to Access initiative that YIVOS is also currently running. So we are running it under the theme Step Up for Access, meaning we need to step up for adolescents' access to SRHR services. So our goal is three-tiered. Firstly, it's centered on evidence generation. We've developed policy briefs for all the 5 countries. So maybe just to go back a bit, we've been implementing the campaign since 2024. So we've learned from 2024, 2025, and currently 2026. So still going back to the three-tier approach, we've got evidence generation, whereby we've created or developed rather 5 policy briefs for the 5 targeted countries, which is Zimbabwe, Zambia, Malawi, Uganda, and Kenya. So upon developing evidence, speaking to the harmonization of the laws, and also speaking to different laws and policies that govern access to SRH services for adolescents and young people. From there, the evidence that has been gathered, we've been then using it to sustain momentum on advocacy. What is it that we've gathered? The differences or the synergies within the countries, how have we been using those to ensure that policymakers, stakeholders, and young people themselves are actively engaged within the campaign? And then lastly, it's also regional integration, whereby we are constantly bringing together the 5 countries across the ESA region to sit down and do cross-border peer learning in terms of what is working in Zimbabwe that can be adopted by a different country, or what is working in Malawi that can be adopted by a different country as well. So looking into this, what I would advise, or what I would table on the campaign, is to say other partners or other CSOs that are also doing similar initiatives. First and foremost is to gather the support and the backup from government line ministries within the context that we are implementing. Because when we are implementing, we shouldn't just run in silos as organizations, but we also need intel from our government line ministries in terms of how do we coin the campaign? How do we table out our issues to different policymakers and lawmakers, so that what we are saying or what we are advocating for also aligns with the priorities for different countries? So for example, maybe starting off with 2024, I'm going to just highlight that in different countries, we were running with a campaign saying age of consent campaign. So when we're talking of consent, traditional leaders, religious leaders, and other policy makers as well, they articulated the consent that we're talking about to sexual consent. So from the conversations, integration that we are doing with different government line ministries and policymakers, we were then told that there is a need for us to differentiate which consent are we talking about. So without that integration and stakeholder involvement, we would have just been running with a campaign that wouldn't have gotten the reception that we were anticipating. So come 2025, we retermed our campaign to say Step Up for Adolescents Consent to SRHR services. And then we saw different countries, and then we saw different stakeholders now opening up to the conversation to say, now it's clear that we are not talking to age of consent to sexual activity, but actually opening up services to adolescents and young people, which paved way rather for communication and conversations that everyone was understanding. And then also moving forward, another recommendation that I can also say maybe to us as partners that are being supported by HIVOS as well, is to say when we have activities, yes, we do have partner A, partner B, partner C having their own activities, but synergy as well within partners, it's also critical in terms of ensuring that our activities are aligned and they speak to one goal that we want to achieve at the end of the day. I think for now I will stop there.
Okay, thank you so much for that, Noku. Before you rest or you rest your throats for this one, I would like you to come back just to tell us more on what you just mentioned. You've mentioned to say at some point when it was age of consent, it was being misunderstood on if it's access to services or if it's consent to sexual activities. But I would like you to just highlight or just give us an idea of how you have been engaging young people in this campaign as youth advocates. How have you been doing it in terms of just bringing young people together and just engaging them, ensuring that they are informed on this particular campaign?
Okay, thank you, Margaret, on that. So one key thing about the campaign is that we've ensured from the word go that it's youth-led and youth-driven. So in terms of how we've been effectively engaging adolescents and young people in the campaign, so earlier on I spoke to issues around evidence generation, how we've been gathering data and how we've been gathering information from different countries. We've been working with young people from different CSOs and also young people from the Youth Advisory Panel from HIVOS in terms of ensuring that the data that we are collecting is youth-centered and it's youth-informed. So the information itself is being gathered by young people, and then from gathering the information, we've been also working with young people, capacitating them in terms of how to analyze the data and how to table it in front of different policymakers. So on the second tier that I mentioned earlier on advocacy, ensuring that the advocacy initiatives are sustained within the countries. So within year 1 and year 2 of the Step Up for Access campaign, we've been also working with young people, convening what we call human-centered design workshop and smart advocacy workshops, whereby we've been saying the policy brief might be something which is big that young people can't comprehend on one go. So we've been sort of streamlining the policy briefs and making them into small bit-size advocacy documents for young people that they can use in terms of disseminating information within their local communities, and also using the same information to spearhead the Step Up for Access campaign through various digital platforms. And then also lastly, when we are doing our convenings, regional convenings, national convenings as well, we also ensure that there is meaningful youth engagement and participation where young people are given sections to present, sections to actually interact with policymakers and stakeholders, so that the voice that we are pushing will be the voice of the young people. The issues that we want to raise are affecting young people, so we also allow the young people to be in the room and articulate those issues for themselves. So that's how we've been ensuring that young people are involved and are actively participating within the campaign.
Great. Thank you so much. It's very interesting and good to know that young people are actually, I mean, this whole campaign is for young people, and them being at the center of it, it's one important thing that we need to put into consideration. I have seen Maida there, she has stayed too quiet, and she's just, I bet she's asking herself, when is Margaret going to ask me a question? I'm here to ask you, don't worry. Before I ask the question that I want to ask Maida, Andrew, do you have any question that you'd like to ask Maida or Nokupewa before I go ahead?
Not necessarily a question, but maybe just to zero in on or appreciate, I think, two things that have come out from Noku's recent comment. One to do with integration and stakeholder engagement, as well as partner synergies, and the aspects of evidence generation. So I just wanted to make mention that TYP 360 rallies on a banner of promoting empowerment of young adolescents and young people through coordinated advocacy. So by that way, we mean what we bring virtually or on an online platform like this, we would also want to do out on the ground in the community. So recently we hosted a district stakeholder validation meeting, and I was impressed that the suggestions to include aspects of the age of consent in our data collection tools, as well as our what we call local health facility performance scorecard, came from the stakeholders themselves. That included the young people, the ministries of health and higher education that were present in the room, as well as health facility staff. So there were key contributions that were made to strengthen not only our CLM tools, but also the scorecard I've just mentioned. So it's this holistic approach, and I really like how Noku puts it, that partner synergy and integration. Yeah, thank you.
Great. Thank you so much for that, Andrew. So I'm getting back to Maida. Please prepare yourself. I'm back for you. So you mentioned to say the campaign is being run in East and Southern parts of Africa, East and Southern Africa. So I want to know, from the time you started, like I would like you to help us understand when exactly the campaigns started running in these different countries. And from the time you started, what have you seen? Is there a change that you have seen as Hivos that has pushed you to still being there and just ensuring that this campaign is there, still running, and it has an impact on young people?
Thanks, Margaret. I was literally about to sleep because I thought you'd forgotten about me. So I will just speak to what Andrew and Noku have just said. I think the evidence is already there. One of the biggest objective or the major objective that we had on the campaign was to ensure that we strengthen the capacity of youth-led and youth-focused organizations. So one of the biggest key highlights that I can allude to is the fact that now we have a cohort of strengthened youth-led and youth-focused organizations, as well as young people and other stakeholders that are able to conduct joint evidence-based advocacy and awareness raising issues around the age of consent. So we have seen a more coordinated approach in the way advocacy is being conducted around the issues of age of consent in the region. And then we have also noted enhanced policy. There's been enhanced policymakers and programmers and champions and opinion leaders awareness when it comes to the issues around the age of consent. I think Noku and Andrew have already touched on the aspect of working with key line ministries, working with different key stakeholders in some of the initiatives that they're doing at national and regional level. So there's been enhanced awareness around it. And I know that as the fund, we do have a cohort of regional champions that we also capacitated on some of these processes. And we do have policymakers who are actually ensuring that they raise awareness or champion some of these initiatives in their constituencies. We're also working with traditional leaders who are now also bringing such conversations to the fore during their meetings or any interventions that they're having. At a regional level, we are also in the process of developing with other key stakeholders such as SADC PF, Plan International, K International, where we're looking at developing an M&E framework for ending child marriages. So there we have also seen an opportunity where we're going to infuse an indicator or two that's highlighting the issues of age of consent as one of the biggest barriers, particularly to accessing sexual reproductive health and rights for adolescents and young people. So we've seen a lot of opportunities that we have taken advantage of, and some of the key results are already in the process of being actualized. And we're hoping that by the end of the project, we're going to have some attainable results from HIVOS as well as through our implementing partners. And lastly, we have young people on this platform already. So I think one of the major objectives that we also focused on was to ensure that we amplify the voices of the young people when it comes to meaningful youth engagement and involvement in advocacy processes around the issues of SRHR, especially age of consent processes. So Noku and Andrew can also attest the fact that we've seen a lot of young people participate in different policy spaces, whether it's consultative processes that are taking place with different parliaments, or whether it's reviewing different bills around health policies or health bills that are being tabled in different countries. We've seen a lot of young people that were built capacity by our partners being able to participate fully and effectively and meaningfully in such spaces. And these are some of the wins that we have literally harvested so far in the project. And just to articulate correctly the timeline, I think this process has been happening for almost 4 years, where we co-created the campaign. This took a bit of time, like I indicated earlier, that it took a bit of time in the sense that we wanted it to be led by the youths, by the young people themselves. So the co-creation process started about 4 years ago, and then now the actual implementation is what you're now hearing and what you're now seeing from the partners as some of the key major results that they were able to achieve. I'll also speak to some of the activities that we have, activities or approaches that we have implemented as the fund or are currently implementing, but are also being taken up by our partners as well. So the aspect of evidence generation, this is something that we've been hearing from both Andrew and Noku as well. So as HIVOS, we do have a youth research academy that looks at all aspects research. So when we look at the research that the young people are actually producing, it's speaking to the issues of age of consent. And we're working with different organizations in this case, where they're also looking at ensuring that they generate evidence through strategic litigation, through evidence generation, through different processes or approaches that they're utilizing, whether it's development of policy briefs, like what Noku has highlighted, contextual analysis, technical briefs. These are some of the advocacy outputs that we've seen from some of the approaches that we have utilized. And we've also seen a lot of mass media engagement. I know we have trained a cohort of regional media personnel, and we've seen an increased reporting around the issues of age of consent, particularly from the media personnel themselves. And I know that our partners have also equally done the same. As of today, I can safely say we have over 80 articles that have been written, or articles or news items that have been shared by our media personnel, both from the HIVOS end and from the partners end as well. And we've also utilized the policy engagement approach, like what Noku said, the regional convenings that we've had in the past, the policy engagements that we have had at national level, where we're able to discuss the issues of consent in detail with the key line ministries and various stakeholders in the particular countries. So these national engagements, you'll notice that they then fed into the regional picture, which has helped us be able to come up with to set an agenda that is more regional focused, especially the action plans rather. And then we also did a lot of, we're also utilizing the networking and strategic partnership approach. So you'll notice that on the campaign at a regional level, the fund is working with SADC PF, we're working with other NGOs, like I mentioned earlier, such as Care International, Plan, UNFPA, SRO. We're also working with Equality Now on ensuring that we champion these initiatives. And we're also working with IALA in the Eastern region as well, so that we have a coordinated approach in how we're advocating for issues around age of access to SRHR services. And then lastly, there's the aspect of meaningful youth participation. this is something that we have been that we've been deliberate about throughout the process from the beginning, during the campaign, and now as it's coming to the tail end, this is something that we're ensuring is constantly happening. And we've seen a lot of young people actually take up space, lead some of these processes at national level, at regional level, in different spaces where they're influencing, in different places, different spaces, where they're able to influence or issues around sexual reproductive health and rights. Thank you. I think I've done my fair share of talking.
You see the reason why I never wanted to ask a question. I mean, she has just explained everything, including my follow-up questions. She has responded to everything. That's why I kept her quiet like that. But anyways, thank you so much, Maida, for that explanation. It's highlighting a number of things, and we really appreciate it. So looking at time, it seems like we're running out of time, and we can't just leave without really getting our last words from the people on the screen that you're seeing here. Obviously, Maida is going to be the last person. If I tell her to come first, she might just finish our time. But anyways, I'm first going to allow Andrew to say something, if you have anything to say before we can close, and then we go to Nokupewa, and then finally Maida will give us her last words.
Well, thank you so much, Maggie. I really feel this particular conversation has really been very insightful. And my call to the young people watching us from whichever part of the world right now, please stay tuned to this show. I think there's a lot more coming for you to learn, so that we, together with yourselves, can, push this campaign forward. And also just to thank HIVO's Regional SRHR Fund for this particular support. I think it's one campaign that I think will ensure that it does get to achieve its intended goal and purpose. So much so that the age-old conversation about the age of consent might finally find its resting place. Thank you once again.
Thank you so much, Andrew. Nokupewa, you can go ahead.
Thank you so much, Margaret. So my call to action for young people is when such spaces are availed to us, we should take them by the horns and ensure that we actively participate and we're actively involved, so that we ensure that our voices are heard and we actually contribute to some of the policies and some of the frameworks that actually address the needs and aspirations for young people when it comes to our health and well-being. And also maybe not only talking to young people directly, but young people in the sense of us, the youth-led organizations and CSOs. This is the time for us to collaborate and ensure that our efforts are integrated, so that the campaign goal and the campaign advocacy initiatives reach different magnitudes, not only the targeted countries, but we also ensure that the voices reach to other borders as well. And then lastly, we would also want to extend our gratitude to HIVO's SRHR Fund for ensuring that these platforms are availed to adolescents and young people. Thank you.
Thank you so much, Nokupewa. Young people, we have heard this is something that has been brought to us, and let us just both hands to grab this opportunity and just use each and every information that we're gaining to use, and just see how best this campaign can help us at the end of the day. I mean, HIVOs can come here and they will be able to support us, but if we as young people, we are not there to just use the information we provided and the services that are being provided, obviously it's not going to help us at the end of the day. So in as much as they are helping us, we should be able to help ourselves as well. So we haven't forgotten about the online community. if you have been part of this live show, you can still just drop your comments in the comment section, and we'll be able to just discuss and still respond to some of these conversations that we get to have in our comment section. Maida, you can go ahead. I haven't forgotten about you.
Thank you, Margaret. I think my parting shot really is from where we've come from. I think one of the biggest lessons that I've seen is that laws and policies in the different countries that we're implementing the project need to be reviewed, developed, and they also need to ensure that that harmonization process actually take place to also address some of these barriers that were stated on this particular meeting that we're on. And then secondly, the aspect of young people engagement, youth engagement, meaningful engagement. We do have the campaign running, so kindly utilize your social media platforms to amplify this campaign. We have a hashtag that we have developed, so it's hashtag consent to access. So the 2 is number 122, not TWO. So it's consent to access, hashtag consent to access, so that we enhance visibility of the issue and we draw attention to the campaign and any other age-related barriers, especially issues around SRHR that adolescents and young people are facing. And then lastly, I would like to thank TYP for convening this space. I think it has provided an opportunity for us to kickstart the conversations. I know there's more sessions or more opportunities for us to continue our conversations, but I think this was a much needed opportunity for us to take advantage of. And then to our implementing partners, yes, always the partner, thank you so much for being our feet on the ground and ensuring that we get the much needed results. TYP, yes, we look forward to engaging with you going forward, and all the other partners that we have collaborated with on this particular initiative. Let's continue working together. Let's ensure that we reach the objectives and the goals that we've set for ourselves. Thank you.
Thank you so much for that, Maida. And I just want to appreciate Nokupewa, Andrew, and of course Maida for just creating time and just being part of this conversation. Obviously, yes, we are kickstarting this campaign as TYP due to having it here on the show. So I just want to appreciate you all for the information that you've provided us with and everything that has been discussed. And to our viewers, you just have to know that the Real Talk Show is here, and yes, we still have more coming on consent to access, and you just have to stick there and just be ready to receive this information, because the information is available, and we are here to just ensure that we're able to discuss and just exchange information at the end of the day. And obviously, at the end of this campaign, we would like to see a change of mindsets in young people. We want to see a number of young people be able to access these services. A number of young people will be able to ask questions, and a number of young people would just like to just learn on how exactly they can access information and these other sexual reproductive health services. So for now, I bet we say a goodbye to you and just let you know that next week we are back with a very interesting topic that you would like to be part of. And obviously at the same time, we're on TYP Facebook page and YouTube channel. Don't forget to follow us, and see you next week. Bye-bye.